We've got your Health Weekend Roundup with Chief Medical Officer of HERS and gynecologist, Dr. Jessica Shepard. She's got a few stories for us this week, starting with a new cancer study. Dr. Shepard, always good to have you with us. Okay, so let's break down this new study from the American Cancer Society. It found that African Americans still face higher death rates than other groups, reporting that Black people were 10% more likely to die from cancer than white people in 2022. Why is this, and what needs to be done here to improve those numbers?
Yeah, Morgan, there are so many things that need to be done when we actually look at this report. And one thing that they did note, which I was glad that they termed it this way, is that there's actually elevated cancer burden. And so why is that important? Because the report actually looked at the rates of death from cancer have declined in Black people, with Black men actually being the greatest decrease in cancer deaths among this group when we think of this racial group. This is good, but there are still much more areas that we need to look at because the actual survival rate for cancer overall are lower in Black people. And that's going to be the largest gaps that we'll see are cervical cancer, melanoma, and endometrial cancer. And actually, when you look at cancer, it is the second leading cause of death among Black men and women after heart disease. So there's still many reasons why we still have to pay attention to these worse cancer outcomes among Black individuals, including things such as screening, treatment, social and economic inequality. So there are still things that we have to do, even though there was a decrease.
Yeah, those screenings are very critical. Next up, one thing I wanted to ask you about, President Trump signed an executive order aiming to reduce the cost of in vitro fertilization, or IVF, but no plan was rolled out. Instead, he's asking for policy recommendations. How impactful do you think that this order will be on the millions of families that are looking into IVF?
Yeah, this is actually a really controversial one. And just, looking at executive orders, they're really not final and they really still have to go to federal court to really look at the lawfulness of them. But in this particular one was looking at the reliable access to IVF treatment, including kind of the regulatory burdens that you see and also the affordability. Now, when I say controversial, the reason is because last year there was kind of a conundrum when we think of the Alabama Supreme Court that said that frozen embryos are extrauterine children. So that can lead to a lot of state issues. And so the recommendations are going to be very hard to come across because every state has, in their legislature, how they deal with IVF. Now, obviously, we want more people to access the ability to have IVF, but there's still a lot of things that need to be kind of sorted through when we think of embryo rights, whether there are some Republicans who support the personhood laws when we think of embryos, and also abortion, which, by the way, is healthcare. Abortion rights opponents are obviously going to argue some of the things that come from IVF, whether it's failure of implantation or ectopic pregnancies.
Yeah, still a lot of questions. And lastly, I personally am asking you this. We all want to get better sleep, and we are looking for a quick fix. A lot of people on social media have suggested that magnesium supplements might help. Doctor, is this true? And if so, what should people know before trying these supplements? I'm asking as a morning show reporter, anchor who does not get a lot of sleep.
But Morgan, that's you and me, because we're both seem to be struggling from that sleep. But sleep disturbances are actually one of the most common health disorders that we see in modern society. We are not sleeping enough. So sleep disturbances obviously have risk. It can actually cause things in the future like obesity, diabetes, cardiovascular disease. But in the end, when we look at magnesium, I know that social media is amazing for highlighting these things, but we also don't want to overdose on supplementation because there are a lot of other ways that we can get magnesium. What types of magnesium? So the ones that I would say to look to are magnesium glycinate and magnesium citrate because they have good absorbability, but looking at our foods as well that are magnesium rich to kind of use that as a source. But magnesium really is a really good way to get calm, relax, and sleep. So I think you should try it.
I just wrote that down. Got it. Dr. Jessica Shepard, as always, we thank you for your expertise.